Um, I've had an honor of serving both at the public and private institute, so I can tell you that breast cancer um, is just not a woman issue, because behind every breast cancer, every statistics, there is a mother, there is a sister, there is a wife. It's a family issue. It is a society issue. And at a larger scale, it is a national policy issue. Unfortunately, it is the most common cancer in Pakistan. And a lot of women are diagnosed, thousands and thousands of women are diagnosed and they die every year. But the fact is, more than 90% of these women can be saved with early detection as well as awareness. So I'm so glad that we have a different segment of society who's coming here, from the students, from the policy maker, from the doctors, from the CPSP. Dr. Asha Siddiqa is here, who's a great proponent of teaching and research. So from a health policy standpoint, I think my limited input is that it has to be a three-pillar approach. Number one is awareness, and that is what we are doing. We should aware every woman about this disease. We should teach them about self-examination. And this message should be propagated at every level, from schools to universities and to homes. And ARIA Institute, we are very proud, and the governor will be very pleased to hear that we have already signed MOU with University of Loralai and Butans and soon University of Balochistan, where we are encouraging the joint research and education, as well as providing internship opportunities for the student at ARIA Institute of Medical Sciences. So the first pillar is awareness. Okay. So the first pillar is awareness. The second pillar is access and affordability. I think the early detection and screening is just not an option. It is every woman's right. If you are living in a small village in Balochistan to a major city like Quetta, this screening should be available, and the government should be driving this screening approach, and it should be completely free of cost. And the third approach is empowerment and support. Those women who are going through that, again, it's a family issue. They go through a lot of psychological trauma, financial trauma. They may have kids in their homes as well. So we also need to address on that part of the cancer, because the cancer treatment is the whole spectrum, from detection to treatment to psychological support. So there has to be a psychological support as well as financial support. So again, I'm so happy to be here. And let's celebrate this month, not just a one meeting and a conference where all the dignitaries are here. So the take-home message is that we need to focus on awareness, and we need to pledge that we should spread awareness, support our women, because every woman deserves a healthy life.